Post-bariatric surgery or post-massive weight loss, there's a lot of sagging that people deal with around the body. Now, we as plastic surgeons, we do various kinds of lifts to correct this sagging and contour the whole body as much as possible. Now, when we talk about the various kinds of lifts, what are those? There's arm lift, thigh lift, there's belt lipectomy, which we call as a body lift. Then there's also abdominoplasty, who do not want to get a body lift, they can opt for abdominoplasty. There's upper back lift, lower back lift, breast lift. So obviously, when we are doing all these lift procedures, what is the main procedure we are doing is removing the excess skin, because fat is mostly lost. So here we are basically tailoring the skin and achieving a better shape. Now, when we are doing all these procedures, there's obviously the concern of scarring that people have. So in this video, let us understand that what can be done to minimize or reduce these scars as much as possible, so that you can be as confident as you want to be with your body. So can these scars be avoided altogether is a very common question. Well, they cannot be avoided, but we as plastic surgeons, what we do is place them in areas where it can be concealed very well, and also give as thin a scar as possible to you. First, let us understand what are the types of scars. The most common scar that we see to treat are the hypertrophic scars. Then there are keloid scars and atrophic scars. So in hypertrophic scars, basically you will notice that these scars are raised and angry looking and they itch a lot. So these hypertrophic scars are best treated when they are identified early on, because this itching cycle continues and the scars continue to become more and more hypertrophic, and it becomes a little difficult to treat them with fewer sessions later on. The second type of scars are keloid scars. So in keloid scars, basically it's your genetic tendency that you are a keloid former, and if we know that beforehand, then we can start the treatment even before it forms. Then there are atrophic scars. Now atrophic scars are generally thinned out scars, thinned out pale looking scars which do not have enough strength to hold the tissues together, and this majorly depends on what your nutritional condition is when you're getting the surgery done. Now let us understand how we can minimize the scarring and how we can have the best scars possible. So the preparation to having a better outcome from your surgery begins not only at the surgery day, but in fact before the surgery day. So what can you do to minimize the scar? You can have a healthy lifestyle, you can quit smoking, reduce your alcohol consumption or avoid it altogether. Then obviously have a lot of protein intake, because collagen is needed in scar formation and that is mainly derived from protein. So obviously having a good nutritional status before your surgery and having a healthy lifestyle goes a long way in having a good scar. Now during the surgery, obviously the surgeon's meticulous technique, it comes to play when we are wanting to have a very good scar. So obviously expertise of your surgeon is also a major determining factor in the type of scars that you'll have. Now what about post-op? In the post-operative period, it is important to follow up with your surgeon so that these scars can be identified early and the treatment can be started early. So obviously silicone gel is a very important thing to do when we are wanting the scar healing to be better. So silicone gel application or even massage when your doctor tells you to start the massage. The second thing is silicone sheet, gel sheet application. So application of silicone gel sheet, it applies a certain amount of pressure and keeps the moisture in the scar locked. And that is how the scar modulation becomes better. The third thing is pressure therapy or wearing compression garments as according to your doctor's advice. And once you do that, the compression works again for mechanomodulation and the scar becomes better. Keeping the scar moisturized is also one of the key determinants of having a good scar. Now, if the scars are at an area which can be sun exposed, then you should apply a sunscreen definitely before stepping out. However, it is highly recommended that you don't expose the scars to sunlight at least for the initial 6 to 8 months of the healing. We commonly perform in-clinic procedures so that the scars become better with time. Among them are the CO2 laser, the microneedling radiofrequency or MNRF treatment. Then there's Q-switch laser to reduce the redness, IPL can also be done to reduce the redness and the hypertrophy of the scars. So these are few treatments that we can do in the clinic to help you achieve a better scar from your surgery. So obviously, in today's day and age, we have a lot of therapies at hand, at home and in clinic options to reduce the scarring as much as possible. So you should not be scared of these scars when opting for body contouring surgeries because they are pretty manageable. I hope that you liked the information that I shared in the video about management of scars. If you still have questions, do not forget to drop them in the comment box below and I shall be very happy to answer them. If you liked the video, do share it with your friends. And on our channel SB Aesthetics, we keep posting very interesting information about plastic surgery. Do subscribe to the channel and keep the notification bell on so that you get notifications for the new videos. Thank you for watching.